Health officials around the world monitoring the Omicron COVID variant. More countries report their first cases. We'll go live and speak with a doctor in South Africa, where it was first detected, in a minute, to find out what they're seeing. The WHO is calling Omicron a variant of concern. It says the strain could be the most contagious so far. But remember, more contagious doesn't necessarily mean more deadly. Meanwhile, the U.S. and dozens of other countries have imposed travel bans on South Africa and other African nations. Omicron has not been detected yet in the United States, but 2 cases have been confirmed in Canada among 2 travelers who'd recently been to Nigeria. Today, Brazil and Japan confirmed their first cases of the strain. Meanwhile, the chief medical officer of Moderna expressed concern about whether the current vaccines will protect against the variant.
How transmissible is it? We think it's probably quite transmissible. But how severe is the disease it causes? We don't really know the answer to that question yet. And will it be neutralizable? Can we contain it with the currently available vaccines? So we at Moderna and other vaccine manufacturers here in the US and around the world are testing samples from people who have received our vaccines against the strain.
Now, this all comes as an FDA committee-approved Merck's COVID treatment pill today by a vote of 13 to 10. That's good news. The pill still needs final authorization by the FDA, the Center for Disease Control, to be approved for emergency use. But let's go now to Johannesburg, South Africa, and Professor Rudo Mathivha. She's the Director of Critical Care Medicine at Chris Hani Baragwanath Academic Hospital, the largest hospital in the Southern Hemisphere. Thank you so much for staying awake for us. We really appreciate it. Let me ask you to start by telling us what you're seeing there and anything that you're seeing that might tell us something about what to expect beyond South Africa.
Okay, so South Africa just entered the 4th wave of COVID. If you may recall, we had a brutal 3rd wave with the Delta variant, where we lost quite a few people from that wave. And we kind of went into a lull of complacency because the number of COVID patients had really dropped down to not quite to 0, but to very little. And then about a week or 2 ago, the number of positive patients started reappearing. And the worrying thing was the demographic profile had changed a bit. We were seeing younger patients being infected, children, toddlers being infected, and actually getting sick. This hadn't happened before. The kids just used to shrug off COVID and live with it and, until the infection was over. But this time we were seeing children under 5 and children in the age groups of 10 to 15 coming in with symptoms severe enough to warrant admission. And we saw 17-year-olds, 18-year-olds coming to hospital with severe disease warranting intensive care admission. I must admit, though, there were a lot of other patients that came in mildly symptomatic, young 20s to late 30s, who tested positive, that we could just advise on how to take supportive therapy at home, and they would go. And this kind of worried us because we hadn't seen this pattern before. And I had a discussion with my colleagues, and I said, this is a strange pattern. We're no longer seeing the elderly patient with comorbidities being the problem. And maybe it's because we had already intervened in that group with our vaccination rollout. But the age groups that we were seeing had not been vaccinated. The early 20s and mid 30s had actually been reluctant to get vaccinated. Most of these are university students. We had quite a strong anti-vaccination lobby in our country. And they did get to the people, and people did not get vaccinated.
I've only got a minute left. I want to just ask you about that. So are you seeing, or based on what you're seeing, does that suggest that the vaccines are protecting against Omicron?
The vaccines are protecting against COVID infection. Because when you get COVID infection and I test you with a PCR, I cannot tell you you've got Omicron on the spot. I need to send your sample for genomic studies. Then they can tell me it's Omicron or it's Beta or Delta. There isn't a bedside test to tell me I'm dealing with Omicron. What can make me suspect that there's a new player is the symptomatology and the age group shifting that we haven't seen before.
Got it. That's very helpful. Professor, thank you so much for your insights. Thank you for staying awake for us. We really appreciate it. This has been very useful.
Thank you for inviting me.
Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.